the area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. Tonight, we're going to be talking a lot about the knee and the hip. I mean, two bones there that, can cause a whole bunch of different kinds of ailments. And tonight on the program, I have Dr. S. Richard Zavoyski, orthopedic surgeon with Delray Orthopedic Center, right next door in Delray Beach. DelrayOrthoCenter.com. I'll give out the address and the phone number in a bit as well. So without further ado, I want to welcome Dr. Zavoyski to the program. How are you doing this evening?
I'm fine. Good afternoon, everyone.
Thank you.
Yeah, thank you for having me.
Thank you for coming aboard. I always say to doctors on this adventure of health, because we always learn so much more than, we knew before going down, the path of, healthcare in South Florida, which is ever changing. And I know you focus, correct me if I'm wrong, but you focus mostly just on the hip and knee.
That's correct. Yeah, I'm a fellowship trained hip and knee reconstruction specialist. So we're talking about hip and knee replacements.
Okay, and these are for adults?
That's correct. Yeah. So
okay.
Typically we do those in adults. Yeah.
What is about the age range of your typical patients?
Well, typically you're in your 60s when you have this done, but I've done it in as young as 18 years old for various reasons. Yeah.
Oh, wow.
Yeah.
Okay, so 18 and up, definitely. Now, it sounds like a bit of an easy question, but it kind of could, I think it could be a little more complex. What's the difference between surgical and non-surgical care? Because you offer both at your practice. I mean, sometimes if surgery is not the option and there's an option for a non-surgical care, you'll go down that road.
That's right. So we offer a very wide spectrum of treatments for hip and knee pain, hip and knee problems. Those can range anywhere from something as simple as taking a medication to something as complex as doing a redo or revision knee or hip replacement. So we offer things such as medications, physical therapy, bracing or durable medical equipment. Sometimes people will use canes or a simple cane or a walker to help them get around. We can also do injections into the joints of various substances to help with the discomfort. And then finally, if everything's really not working, then we start to think about surgery, which is where we're making an incision and changing the structure of the joint to going from an arthritic knee or something that has a problem to a new metal and plastic and ceramic components to help alleviate the pain and discomfort that come along with these various diseases.
That's definitely good news. I mean, that's definitely some state-of-the-art stuff there. You mentioned arthritis, and I always like to put doctors on the spot because I know there's a whole bunch of different types of arthritis, but definition, what is arthritis?
Right, so arthritis can mean a lot of different things, but what we most commonly talk about is osteoarthritis, or what people say is wear and tear type arthritis. So that's the arthritis that we get as we age. What happens is our cartilage has a very limited capability to heal. And as we do different things during our lifetime, we cause little tiny tears or rents in the cartilage, and over time those get worse as the cartilage wears out. And eventually when we hit our 50s, 60s, 70s, it starts to kind of catch up with us and we start getting discomfort. There are a bunch of other types of arthritis, like rheumatoid arthritis, arthritis that you get after an injury. There's secondary types of arthritis or arthritis for other reasons. But by and large, most of the arthritic pain that people get is osteoarthritis.
Osteoarthritis. Okay, so that's mostly the most common.
Very, very much so, yeah.
Uh-huh. And now if those tears or issues aren't taken care of, isn't it kind of like a piece of paper? You kind of keep on tearing?
Yeah, there's no
It'll
stopping
never stop,
it,
right?
unfortunately. I mean, there's no way for us to stop it or slow it down. When we have arthritis, the vast majority of treatments is designed to help with the discomfort that comes along with it.
Mm-hmm.
Yeah, the only true cure for arthritis is to take it out and replace it.
Oh, okay.
Yeah.
So that's kind of the last straw there.
Yeah, last step.
Last step. Now, I've heard a lot about total hip and knee replacements. Is that something that you focus on?
Correct. Yeah, that's my specialty. So, as orthopedic surgeons, we have our training in orthopedic surgery generally from the neck down. Mm-hmm. And then after the orthopedic surgery training, we can subspecialize or do an extra year of training called a fellowship. And the year of training that I did was called adult reconstruction, which is the medical word for hip and knee replacement surgeon. So
okay.
So the people like me have specialized training in the hip and knee replacements. So you do anything from your standard arthritis to complicated joints with different problems. And then you can also do the redo replacement. So the people who had a knee or hip replacement and it's just not going well for whatever reason, then doctors like myself can fix those problems.
Is that called a revision?
Yeah, revision surgery. Yeah.
Okay.
Yeah.
And that can kind of happen. I've read a few testimonials and whatnot. Maybe someone had surgery X amount of years ago, a few decades ago, and over time, revision is needed for. It can be a long list of reasons why.
Yeah, there's quite a few reasons for needing a possible redo surgery, depending on what has happened. But that's why it's important to see a fellowship-trained hip and knee specialist, because we're best able to figure out what has gone wrong, what's the issue, and how can we fix it. Mm-hmm. And then we have the training to be able to do that. For knee replacements, the most common reason for revision is either loosening of the implant from the bone mm-hmm. or infection.
Okay.
And for hip replacements, the most common reason for revision is changing, but typically it's either wear of the plastic, infection, or dislocation.
Okay, so those are some of the main reasons why. We're here with Dr. S. Richard Zavoyski, orthopedic surgeon with Delray Orthopedic Center. Is it a new practice here in Delray Beach?
Yeah, that's correct. We opened 5 weeks ago.
Oh,
So
congratulations.
we're brand new in the area, correct, yeah.
Okay, and what hospitals are you on staff at?
Well, right now I'm at Delray Medical Center.
Okay.
We're working on getting on some other facilities, but primarily Delray Medical
That's
Center.
a great hospital. You picked a great place to start.
Yeah,
Definitely.
we're very pleased, yeah.
Yeah, very busy hospital, trauma center as well.
Yeah, that's correct. It's a level 1 hospital, so they're able to take care of any patient who comes through the door. And with my help, that includes any hip or knee patient.
Okay. And did you just come from surgery today?
I did, yeah. I did a hip fracture today.
Oh, wow.
Yeah.
Okay, thanks for sharing that with us. I know you can't tell us too much about it, but it's good. It's amazing, you know. That's why I'm so happy to do this show. I mean, I'm lucky to have doctors like you walk right in the door from surgery and just tell us the latest in healthcare in terms of, you know, knee and hip replacements.
Yeah,
so that is just amazing.
That's part of why I'm in this is because medicine's so exciting in that it changes all the time.
Mm-hmm.
I mean, from we get journals every few weeks and things can change. You read a journal article and something in there that looks good or promising, and then you change your practice. And over time, things tend to get better and better. In fact, my wife was commenting today, we've had several patients who, in this new facility, Delray Medical Center, with their expertise and my assistance, we've had patients getting up within 2 or 3 hours after surgery and leaving the hospital the next day, or sometimes even the same day. But it's really, really coming along and advancing very well.
Yeah, the strides made in orthopedic surgery, cardiac surgery, and neurology as well. And just the last few years, where people are having interventions or procedures done, and then, like you said, walking out of the hospital a few hours later is just amazing. I'm glad to see it. I mean, it's great for South Florida. We have great doctors like you here. You mentioned fellowship training a few times. Where did you do your fellowship training?
My fellowship training was at the Florida Orthopedic Institute. That's a facility in Tampa, and they're one of the largest orthopedic groups in the state. So they do a very high volume of surgical cases and see a lot of patients. So I thought it was pretty good training to go to a place like that.
Most definitely. And you're board certified as well, I read on your website, right?
Yeah, board certified. So we take all these tests to make sure that we're doing what's right for the patients. So it's important to have a board certified physician, yes.
We appreciate that, because that's how you get the, stay up on the latest as well. And where did you do your residency internship in medical school?
Medical school was at the University of South Florida. That's in Tampa. My internship was at Orlando Regional Medical Center. So that's Orlando. It's another level 1 trauma center. And my internship was in general surgery trauma. And then residency at the University of Miami, which again is level 1 trauma center. So I have a lot of experience with not only your routine cases, but also people who are very badly injured or have very serious conditions where they need the highest level hospital care out there.
So trauma cases and I guess high-risk cases as well.
That's correct, yeah.
Are you from South Florida?
I grew up in Jacksonville. My dad worked for the Navy, so I moved around a lot as a kid, but primarily grew up in Jacksonville.
Okay, great. So native Floridian?
Almost. I was born in Pennsylvania.
Okay,
Yeah.
that's all right. I'm a native Floridian, so I always ask. But we'll let you join the club. You've been here long enough.
Well, I've been here since 85. So.
Okay, you're in.
Yeah.
You're a native. And what brought you down to the Delray Beach area, and why did you want to open a practice here?
Yeah, well, I did my training in Miami for residency, and I met my wife here, and we both really like Southeast Florida. We like the weather, the climate, the beach, and also there's a good population of patients in this area who are in need of a physician like myself. And given that there's what seems to be a limited number of fellowship-trained hip and knee surgeons in the Delray area, I thought it was a good spot to set up shop.
And baby boomers, I mean, you mentioned the first thing I asked you, you said the average age is probably 60, and that's got to be right in there. So that population is, beginning to go through the aging process, and they've always been going through the aging process, but more so than other times in their life, and different ailments as well. So we're glad to have you here as well. We got about just a couple 30 seconds before a commercial break, so I just want to give out your info, and on the other side, talk a little bit more about the hip and knee ailments you offer, and then also a little bit about robotic and computer-assisted surgery, because I think that's really neat. So it's Dr. S. Richard Zavoyski, orthopedic surgeon with Delray Orthopedic Center. It's DelrayOrthoCenter.com. DOC, I like that, Doc.
Yeah.
561-665-7701 is the number, and he's located at 5130 Linton Boulevard, Suite B2, Delray Beach. That's right next to or on the campus of Delray Medical Center. Hold that thought, Dr. Zavoyski, and we're going to take a quick break, and on the other side, we'll talk a little bit about that robotic and computer-assisted surgery on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. Welcome. We're here with Dr. S. Richard Zavoyski, Dr. Zavoyski, orthopedic surgeon with Delray Orthopedic Center, and on staff at Delray Medical Center, great hospital in Delray Beach, level 1 trauma center, Dr. Zavoyski pointed out as well. And I'll give out the info to his office once again, 5130 Linton Boulevard, Suite B2 in Delray Beach. Numbers 561-665-7701. His office is right on the campus at Delray Medical Center. Before we get into the robotic and computer-assisted surgery, I want to ask you another question on hip surgery. Now, what's the difference between like a hip replacement, total hip replacement, versus like I have here an anterior approach or anterior hip replacement? Is that a little different?
That's correct. There's been a lot of support for this thing called a direct anterior approach or an anterior hip replacement. It's a different way of getting into the hip joint surgically. The approach has been around for a very long time, but recently, in the past 10 or so years, people have started using it for the hip replacement. And the advantage of the direct anterior approach is that you don't have to cut any muscles away from the bone to get into the hip joint. So it's thought that that will produce less pain, less complications, and possibly an earlier return to normal walking, and hopefully earlier pain recovery. So as a fellowship-trained hip and knee surgeon, I'm able to do that as well as any other approach to the hip, depending on the patient's circumstances. But yeah, we offer quite a few direct anterior hip replacements, and almost everybody can have that done. We just have to evaluate you and make sure it's right for you.
Okay. And then just bouncing from the hip back to the knee, there's also a partial knee replacement that you do as well.
Yeah, so partial knee replacements are very interesting because there's a small set of patients who have arthritis just in one part of the knee. And instead of replacing the entire knee, we just replace the part that's damaged. So the way I do that is with a computer and a robot. And it's actually pretty cool. It's the robot sets up an image of the knee, and you resect the precise amount of bone that you want to resect to be able to put the metal pieces in as perfect as possible, to have the knee as perfectly as you can, and then that hopefully will allow for early recovery and less pain and things like that, better function. So I do really enjoy doing those because it's quite neat because of the technology that's involved.
And it's minimally invasive as well, right?
It's smaller. Yeah, it's a much smaller surgery than a total knee. Yeah, and people recover quite a bit faster, about half the time than a total knee replacement. And people feel like it's a more normal feeling knee because they still have their own native knee for the most part. There's just a part that's been replaced. And
it's more precise as well.
Very precise, yeah.
So when people sometimes hear robot, they think maybe a robot is programmed, on its own, but you're controlling this robot.
Correct. Yeah, I tell the robot where we want to make the cuts, and then the robot helps me stay in those bounds. Yes.
Definitely. Does the robotic surgery device or machine you use, is there a specific one?
The one that I use right now is called the Mako. Or They also call it a Makoplasty.
Yeah, I've heard of it.
Yeah, so
like spelled like the shark, M-A-K-O.
M-A-K-O, yeah.
Yeah.
I really do enjoy it. It's fun to do.
Yeah, that is really interesting stuff, and that's great that Delray Medical Center has that and that you're using it. I mean, that's amazing. Yeah. Definitely great for patients, great for the doctor. You're excited about it, I can tell as well. So that's great news. Now, do you also see a lot of fractures in your office as well?
Well, we do, yeah. As an orthopedic surgeon, we take care of different orthopedic conditions, so things like fractures will come to us. So, as my training, we said that I did a lot of rotations and training in level 1 trauma centers. So I've seen really, really bad injuries, and I do feel comfortable taking on some of those cases and fixing the fractures and making sure that everything kind of gets put back in its place and allows the patient to heal. So we will see some fractures in our office and through the hospital, and we fix them up the best we can.
What are some of the most common causes of fractures? Is it like trauma, like car crash? It could just be...
Yeah, car crashes, falls.
Falls is a big one, yeah.
Twisting your ankle, you can break a bone. It can happen, yeah.
Yeah.
Yeah, but, if it needs surgery, we can do that. If we feel it doesn't need surgery, then maybe a splint or cast or a brace and get the bone healed.
That's good to hear as well. Yeah. Definitely. Now, let's talk a little bit. We kind of touched on it before. Is joint injections? I'm sorry. So that's a non-surgical approach to hip and knees. Maybe something that can be done to maybe bypass surgery for the time being, or maybe if it works,
right?
And completely.
Yeah, I mean, we do several different types of injections in our office. The most common is a cortisone shot or a steroid shot, and what that does is it inhibits the inflammation happening from the joint, and that the inhibition of the inflammation doesn't allow the pain to occur. So cortisone shots work really well, but they don't always work. So then we have some other options available, such as hyaluronic acid, which is I call it a gel injection, where you're injecting some of the fluid that's already found in the joint, and it helps lubricate the joint and makes it easier to move, and that over time will relieve pain. And then we have some other options that aren't covered by insurance, like a platelet-rich plasma injection or PRP injection, and then the stem cell injections. So we offer quite a wide variety of non-surgical injection treatments for the patients to try and alleviate their pain and hopefully delay the need for a hip or knee replacement.
Now, PRP injections, that's where the blood is taken out from a specific area where the pain is and spun in a centrifuge and then put back into the patient in the same office visit.
Yeah, correct.
Could almost be done during like a lunch break or something, right?
You draw the blood out, you spin it down, and then there's a certain layer of where the platelets live.
Mm-hmm.
And that has a lot of growth factors and what we would call cytokines to try and elicit a healing response in the knee. And by hopefully eliciting that response, it helps with the pain.
So one thing I'm realizing here is, Dr. Zavoyski, you got a lot of different tools in your toolbox for hip and knee, and that's great for the South Florida community. Stem cells, that's always something that perks my ears. Where are they taken from?
Well, there's different options. Some will be taken from the fat in our body, and some will be taken from the bone marrow. And then we have to send that off, and the lab will identify the stem cells, and then we're able to inject them into the joint. And the goal there is to get these cells, which can change into anything. That's why they're called stem cells. They're able to grow into whatever they want to. And we hope by injecting it into the joint that they'll grow into cartilage. We don't truly know the answer to that yet, but there are several people who really feel that it's benefited them, and it is an option. Unfortunately, it's not covered by insurance, but if it's something the patient's interested in, then it is a treatment option that we would provide.
That's great to hear. Mm-hmm. We're here with Dr. Zavoyski, Delray Orthopedic Center.com, DOC, I like that acronym. Delray Orthocenter.com, again, it's the URL, 5130 Linton Boulevard, Suite B2, Delray Beach, right on the campus of Delray Medical Center, where Dr. Zavoyski is also on staff, 561-665-7701. Does stem cell and PRP injections fall under regenerative medicine?
That's correct.
Okay.
Yeah, regenerative medicine.
Great. I thought that as well. Just a couple more questions. What types of bracing or durable medical equipment does your practice offer?
Well, as a hip and knee surgeon, we do have some options for bracing to try and help with pain. The most common is what's called an unloader brace, where the brace tries to push on the leg to unload or put less pressure on the main arthritic area. So since you're not putting as much pressure on it, that hopefully will help with the discomfort. So by far and large, my braces that I use are called unloader braces.
Okay, and that's a non-surgical approach.
Yeah, correct. Yeah.
That's great. So Dr. Zavoyski is a hip and knee expert, does a lot of the latest in hip and knee replacement, robotic surgery with the Mako. That's great. Thanks for sharing that. One last question. What are your hobbies and passions outside of medicine?
Well, outside of the office, we have two beautiful, healthy, smart, intelligent daughters.
Great.
That I spend all the time out of the office with, trying to play around and encourage them to grow up strong, healthy, and smart. Yeah.
That's great. Well, welcome to Delray Beach, Dr. Zavoyski. We'd like to have you on again in the future and talk a little bit more. And really appreciate the opportunity.
Thank you for having me.
And thanks for listening to the You and Your Doctor Show, living a longer and healthier life.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed